Oh, that's me.
It wasn't ready.
It wasn't ready. All right. Brad, right?
Yes.
All right, Brad, let's get you adjusted for the first time. Feels good already, huh, Brad?
Yep.
All right, so your spine is out of line right here, the fifth vertebrae. Here we go. Take a big breath in there, Brad. Let it all the way out there. Good, relax. We got one more right here, the T12 vertebrae. Take a big breath in. Let it all the way out. Relax it. There. How'd that feel, Brad?
I felt
Hey,
good.
stay right there, young man.
Yeah.
So I'm checking your legs. Look how short his right leg is. Look at that. See that? So I'm gonna get his pelvis adjusted and even him out. So your right leg is literally a ½ inch shorter. Let's bring you right over here. So that tells us that the pelvis is rotated down, okay? And it's gonna shorten the leg. I'm gonna bring it back up. Here we go, let's do this. Take a big breath in, let it all the way out, good, relax. There we go, awesome. Boy, you needed that, huh? Good, other side, let it all the way out, relax. There we go, oh, your back is out. Okay, now lay face down, lay face down. Other face down, there you go, Brad. Check his legs out, guys. Perfectly even. Is that amazing or what? Doesn't that feel good?
Yeah.
Yeah.
Yeah, that should.
Yeah.
Very good.
So your neck, guess how many vertebrae your neck has?
12.
Close.
14.
7.
Oh.
Guess how many neck vertebrae a giraffe has?
Same as us, right? 7?
7. Yeah. Very small. Yeah. Isn't that amazing though? Okay, here we go. You're out the top 2 vertebrae. Relax your head. Oh, there we go.
Oh.
There we go.
Oh.
You're welcome, Brad. This is Lucas's first ever adjustment.
Mhm.
It's
Yeah.
exciting. All right, let's see what we got here, my man. All right, so you have 2 vertebrae right here in the middle back. Do you feel the pressure right there?
Uh-huh.
Of course you do. I may as well go ahead and fix it, huh, Lucas?
Yeah, please.
Take a big breath in there for me. Let it all the way out. Blow it all the way out. Relax your shoulders.
Oh,
Amazing.
Oh my God.
Lucas, you need some adjustment. Now I'm
Yeah.
gonna balance the bottom of the shoulder blades here. Take a big breath in there. Let it all the way out there, Lucas. Blow it all the way out. Relax. Amazing. Look at this. You just like your older brother, Lucas. Right leg short. Take a big breath in. All the way out there, Lucas. Good, relax. Let's get this leg longer. There we go. Ooh, that was awesome. Good, relax. There we go. Awesome. Good. Come on up in the chair, okay? Who has more girlfriends?
Me.
Okay, okay. So now your brother had the top 2 vertebrae out on his neck. You just have 1 right there. That's the 3rd vertebrae. Just relax your head in my hand. Relax.
Oh.
Beautiful.
That felt good.
Yes. Okay, let's rotate to the side. There we go. There you go. Good. Do you guys like pop and crack your own necks?
Yes.
I can tell.
Is that bad for you?
Yes, it is.
Yeah.
Yes, it is. I'll explain why at a different date.
All right, Doc, having a problem.
Okay.
Ever since I've been on a roller coaster, I can go like that. I'm wondering
Whoa.
if you can fix me up.
You know what that sounds like?
What's that?
It's called macaroni neck. Yes.
You're right. I got a whole pocket full.
You can't fool me. You can't fool me. Now, did you just have the 2 boys, Dad?
Yes, sir.
That's awesome.
As far as I know.
First, I'm gonna put my hands right in your skin here, okay, Dad? Mm-hmm. Oh my, Dad's whole spine is jacked up. I'm gonna fix one at a time. Sound good, Dad?
Yes, sir.
Let it all the way out. Relax. There we go. Dad's the most vocal. All the way out there. Let's bring the shoulder way back. There we got it. There we go. Awesome. Good. Come on, Dad. So Dad is out in 2 areas. Actually 3. Number 2, 3, and 4. Dad, you ready for this? This is called turning the power on.
All right.
Here we go. Relax your head in my hand. Just relax. Oh, amazing. Good. Oh, that's me.
It wasn't ready.
It wasn't ready.
That's even better, Dad.
Oh, goodness.
Excellent. Very good. I think Hugh does need adjusted, doesn't he, Ryan?
Yeah.
Yeah, he probably does. He's pretty, he's the best.
Come on, Hugh. You go, boy. Yeah, good job, Hugh. Good job.
Let me tell you if you can hear my back. Dang, I should probably go see a doctor, huh? My friends was telling me I need to see a chiropractor. Nobody's bones pops like that.
Big breath in, hon. Let it all the way out there. Good. Oh, that was amazing. Big breath in there. Let it all the way out. Good. Relax. Oh, that was so good. Right there, hon. Take a big breath in there. Let it all the way out. Bring it down. There you go. Let the chin relax. Keep on coming to the ground. Very good. You comment on every video.
That's true.
I appreciate you. Let me see you on here.
Good to see you too.
How's school going?
Tough.
Tough, yeah. You're ready for some adjustments then?
Yeah.
Good, relax. Let it all that drop those shoulders. That's good. There we go.
That's okay.
There you go. Beautiful.
Oh, that's the best.
That is the good stuff. Leroy has a retrolithiasis. That means the L5 vertebrae slip backwards. Retro means backwards, posterior. So this machine presses the vertebrae forward. It takes the pinch off the nerve.
I used to go 3 or 4 times a year.
3 or 4 times a year, you used to go to the hospital due to back pain. Since you
And my
started, how many
neck.
years you been here? 10?
And my neck.
How many years?
Maybe 8, 9.
8 or 9? Yeah. No hospitalization since he's been under care.
No.
Good. Relax, Leroy. Relax. Amazing. Good. Drop that hands. There you go. Awesome.
Good morning, everybody. It's Dr. Baker. I'm here with Zion. He's going to get his first chiropractic adjustment. Right. Howd that feel, Zion? Yeah, he said it felt good. Right. Why are you laughing? Hurt and laugh don't go together. It startled you.
I feel better now, yeah.
Yeah, you feel better, huh? You good, buddy. You did great.
Yes, sir.
Beautiful. Awesome. Good. Do you mind if I talk about your hands?
Sure. Yeah.
Okay. So, YouTube family, if you look at his hands, see how they're red compared to this up here? He has a disease called Raynaud's. And Raynaud's is when you have lack of circulation in the hands. So that's why his hands are discolored compared to the rest of them. So by adjusting the lower neck and opening up the nerve and blood flow, that's helped his Raynaud's. And a lot of people don't realize that chiropractic can be efficacious for Raynaud's syndrome. Just like in this young man, right?
Yes.
There you go, my man.
All right, thank you.
Pre-chiropractic, let's do it. Mr. Laura, I need you to look to your left.
Hi.
You're Laura, right?
I know it's been
Good to see you. I know, I missed you. Good to see you.
I got it right here.
Laura, I want to ask you a very serious question.
Yeah, what's
How
that?
many adjustments are you supposed to get a week?
2.
2. Good job. Good job, girl. I still love you. I still love you just the same. How are you? Good. How's your headaches?
Good.
Good. Okay. Did they come back a little bit?
A little bit, yeah.
Yeah.
Don't lie.
So what happens is when you don't maintain your adjustments, your symptoms come back. I still love you.
Her symptoms came
I
back.
still love you.
They
Yes.
came back. I know they did.
Big breath in there for me. Let it all the way out there. Oh, that was so good. And a big breath in there, hon. Let it all the way out there. Good. Relax. There you go. Awesome on your side. Well, guess what? You're going to be headache free when I'm done with you. Sound good? Get you right there, huh? Awesome. Good. I missed you. You must be busy.
I have to.
Yeah, I know. Well, I appreciate that. She missed me, Dennis. She ever say that to you? Or? She does. She does. Big breath in, and then all the way out there. Good, relax, nice and easy. Anyone that can get your headaches gone is you're gonna miss, right?
Oh, yeah.
You know what I mean?
Oh, yeah.
Good. Let's get you right over here. Awesome. Good. Bring you right there. Get you right there. We'll tidy this up a notch. Perfect. Yep, you got it. Big breath in. Let it all the way out. Bring that hip up. I got you.
Whoa. Oh, my
That was
gosh.
amazing. That was the loudest adjustment of the day thus far. Let's check your neck, hon. Lord, that was amazing.
That was a good
Woo.
one.
That felt so good.
That was the loudest
That
of the day.
felt so good.
Yeah,
That was the loudest of the day.
that's why you can't sleep at night right there.
You got the home care kit, right?
Yeah.
Okay.
I do it.
Okay, good. Awesome.
Yeah,
Here we go. We're gonna get your headache free. Relax. Let the chin there, hon.
Ooh.
Love it. Yes, ma'am. That's how we do it. Love it.
My goodness.
My goodness, a whole lot of healing going on. Stay right there.
Okay.
It seems to be a falling apart. Even more than normal.
I'm gonna do one more move for your headache. It's okay. Just
Okay.
a second, okay?
All right.
How's teaching going?
Good.
Busy, busy, busy.
Yeah.
What grade again?
Third.
Third, gotcha.
Yeah.
So now, Laura, you're gonna lay face up.
Okay.
You're gonna drape your knees over the side of the bench there, okay?
Okay.
I'm gonna do what's called a cervical distraction in your weather.
Okay.
What it does, it releases where your skull meets your neck, it takes all the pitch on those nerves, okay?
All right.
Yep, go ahead and lay back. We're just gonna do a nice little distraction right here. I got you. There you go.
Oh my gosh.
Does that feel amazing?
Yeah.
See? I can tell you love that. There you go, girl.
Thanks.
You're all set. Better?
Yes.
All right, good seeing you. I miss you. You're welcome, hon. Relax and relax.
Oh,
Awesome.
that was a good
Does that
one.
feel good?
Oh, yeah.
See, the great thing about chiropractic is you get instant relief.
So
No neck adjustment?
no neck. Yeah, I am kind of nervous.
Yeah, you tell.
But my back, like
Okay.
my lower back right here, like I feel like I'm in constant pain every day there.
Gotcha.
I do sit at a desk like all day for editing videos for YouTube and Facebook. It's hard to get up. and get
Let's
out.
check your back out. Okay, we'll start face down right over here. Justin, why are you so nervous, man? I've been doing this almost 30 years.
I don't know. Because this is my first time ever.
Well, I understand. I'll walk you through it, okay? So, this right here, you have a hump in your back when you're editing your YouTube videos.
Yeah.
You're leaning forward, so that's called flexion, okay?
Okay.
So, like, you have 4 vertebrae out right here in the lower middle back. So, the last 4 vertebrae in the middle back, they're out of position, so that you're like humped up like a cat, kind of.
Yeah.
You ever see a cat get mad, Justin?
Yeah.
And actually have a seat right here. Let me check your neck too. You are in great hands, Justin.
All right, I'll trust
Promise.
you.
I appreciate
Trust
you. Do you do YouTube full time?
Yes. YouTube, Facebook, TikTok, all the social media.
You like eating the grow up. And do you feel that right there? So there is a few problems in your neck. Sorry, sorry, Justin. I know you don't. I know you want to deny it, but you can't. These hands tell me everything. So let's do this. Let's go back and get some X-rays.
Man, your hips cockeyed and everything. You're all messed up. Dang, you got something else growing in there. I don't know what that is.
Next one, you're gonna go ahead and face me. All right, go ahead and relax. Go with your back against the board again, hands to your side, and we're moving right up to the neck here. And you are set. You can go ahead and put all your things back on.
Have a seat right here. You ever seen an X-ray of yourself, Justin?
Nope, just dental.
The normal arch in your neck should be 43 degrees, and I can tell you right now, your neck is less than 43. And I can tell you've injured your neck 1, 2, 3, 4, 5. The disc space between the 5th and 6th vertebrae, if I zoom up on it like this, does that look different than that?
Yes.
And that's why when I felt your neck, I said, there's a problem there. Guess where that was? It's right there. See, Justin, I'm putting it all together. You're gonna be happy in a few minutes. So when I zoom up on this, you can tell that your left hip is higher than your right. You see that?
Yeah.
Your left hip is 10.1 millimeters higher than your right. That's a big deal. Okay?
Yeah.
So that's called pelvic torque. So let's get you adjusted.
All right.
You ready? Excited?
I'm ready.
Okay, let's do it. And we're gonna roll Justin to about level. Let's get level 3. And then Justin, you're gonna follow Nurse Lily. She's gonna set you up on this. Linda, you want to get on YouTube with me? Come on, you're a beautiful lady. I know. You're like one of my VIPs. Are you smelling good? Oh, I love her.
So we'll go slowly.
All right, here we go. Whew. Are you nervous, Justin?
A little bit.
Jeez, we've known each other 20 minutes, Justin. I thought you might be.
I know, I'm just nervous about how it will feel.
I know you're nervous. I'm gonna take great care of you. This is my 2nd week of practice. You're in really good hands. So remember, we had those vertebrae out where your middle back attaches to the low back, okay?
Yep.
So when we do this adjustment, you're gonna take a breath in and a breath out. I'm gonna make the adjustment, okay? You're gonna hear clicks and pops. That's 100% normal. That's me realigning the vertebrae up.
Okay.
Justin, you're gonna love it. I swear you're gonna love it.
Alright.
Okay, here we go. Take a big breath in there. Let it all the way out there, Justin. Relax your shoulders. Relax. There.
Oh.
Justin, your first ever adjustment. What do you think?
Felt good.
Awesome. Good, good, good. Now, you're going to lay on your side and face me, okay? Take a big breath in there. Let it all the way out there. Good. Relax it. Relax. There.
Oh.
Awesome.
That was a good
Does that
one.
feel good?
Oh, yeah.
See, the great thing about chiropractic is you get instant relief, isn't
Yeah.
it? Yeah. Now we're gonna do the same position, other side, okay? Let it all the way out there. Good, relax. We're gonna bring the hip up, relax it. I got you, brother. There you go. Awesome. Good. See, that's the look of relief right there. Okay, good.
I needed that.
Hold my hands, come on up. Now we're going right here to the chair for your neck adjustment, okay?
Oh, no. We're doing it now.
Right.
So
No neck adjustment?
No neck. Yeah, I am kind of nervous. Oh, gosh. You're going to crack my neck?
No, I'm gonna adjust your neck.
Oh.
I know you're nervous.
Yeah.
I'm pretty darn good at this.
Okay.
Okay, so I'll take great care of you.
All right.
Totally relax your head in my hand. Nice and easy. Just relax your head. Just relax.
Oh, man.
Well, that, yeah, just
No,
relax.
it wasn't as bad as I thought.
It wasn't nearly as bad as you thought.
I thought I was going to feel like all in my brain and stuff.
No,
That was just
no.
like right here.
No, it's exactly right where it should have been. Okay. Great. Just relax your head. There you go. That's it. Doesn't that feel amazing?
Yeah.
So when we were studying your x-rays, we noticed that your neck was too straight up and down, right?
Mm-hmm.
So this machine starts to restore the curve in your neck. Okay? Totally relax your head. There you go. Lift the chin a little bit. There you go. Perfect. Justin, I'm so excited. You walked through some fear today, didn't you?
Yeah.
A lot of fear.
I did not expect to do the neck adjustment.
No, you didn't.
I've never done it, and I expected way worse.
And congratulations. You did
Thank
awesome,
you.
man.
I
Of
appreciate
course
it.
will.
Thank
Yeah,
you.
Absolutely.
Since I sit down a large
Yes.
portion of the day, what can I do to try to prevent that stress?
So think about it. So if you're in, this is called flexion, okay? If you're like this all day, which I'm exaggerating, but you are.
Yeah, I am. I really
So
am.
what you want to do is you want to get an exercise ball, and you want to land it backwards, and you want to go put your spine in extension.
Okay.
See, because the whole problem is you're in flexion.
Mhm.
You want to go backwards like that.
Yeah.
See, right where my, see this, and you need to come see me again, honestly.
Okay.
But you can tell right where my hands are, this is what the problem is. So
Yeah.
your spine just doesn't move that way because you're in flexion all day because of your sleep.
That's why I probably have to sleep on my stomach. Because I have
Yeah.
to sleep with my back
There
like
you-
this because I'm.
There you go. See, when you're sleeping on your stomach, you're putting your spine in extension.
Yeah. I
There you
can't.
go.
I can't. Sleep
That's
on
your
my back.
body telling you,
That's
bro,
your-
talking to you.
Yeah.
That's your red light blinking, saying something's not quite right.
Yeah.
And then you call 561 care. Right? Right?
Yeah. Thank you. I appreciate
Oh,
it.
absolutely, yeah.
Attention, feel okay? Good.
So Eric also has some lymphadenopathy, so that's a fancy word for inflammation of the lymph nodes. So we're doing some lymphatic drainage right here.
Can you feel it?
Yes, I can. And you're gonna feel a drain. How's that feel, Eric?
Boy, I've been needing that for like 3 days. Wow.
So we're gonna help facilitate the lymphatic drainage of like this. And it takes manual digital pressure to get all that out of there. How's that?
Wow. It was giving me headaches because it was so tight.
Exactly.
This is awesome. Thank you so much.
Always good to see you.
Thank you very, very much. I appreciate it.
Go. Awesome. How's that feel, buddy? Good. Look at the smile. Hey, Juju, do you like getting adjusted? Yeah, how's it make you feel? Good. Yeah. Awesome. Good job, buddy. Now let's do your neck, okay? Awesome. Good job, buddy.
It didn't even hurt that time.
And at the very end, we're going to give Rand a little impulse. We're going to give you a nice little tug. Just a nice tug. There we go. Warming up all the muscles, tendons, and ligaments. Then we're going to give her a little impulse. Grab this right side, man. Awesome. I got to take care of my fellow motorcycle guy. Perfect. Good job. Awesome. Drop your hip. There you go. There you go. Wonderful. Good. To the right. Keep on coming. Awesome. Drop those shoulders.
Now that was amazing. All the way out. There you go.
But he's only 15.
Get it all the way out there, good, relax. I don't know many pro athletes that don't get adjusted, Mom. There you go, wonderful. To the side, there you go, awesome. Bend your head to the left side, relax, lift the chin, sir. There we go.
Oh, God. They heard that outside.
Yeah, amazing.
Jeez Louise.
Good, now we're going to the other side.
Oh.
Relax your head.
Oh, wow.
Whoa.
Did you hear that? Oh,
Dude,
wow.
that's amazing.
Jeez, am I bleeding?
What's going on, Tom? Hey, how are you?
I'm doing good. I'm
Good-
doing
good to see
I'm
you.
a little stiff.
Yeah.
You know, I drive a lot. You know, I'm like a trucker hauling jokes. So I live in my car,
Gotcha.
and I'm just
Yeah. So you travel a lot, and your back hurts.
Yeah.
Yeah. Is it more your neck, your middle back? Your
It's
low
like
back?
my neck
Uh-huh.
and between the shoulder blades.
Sure.
And sometimes I'll do this, and I can feel something kind of popping lower.
Right.
So I think it's just kind of the last time I had an adjustment was at a chair in a Burger King in Bowling Green, Kentucky. I leaned back and I was like, I felt something.
Yeah.
And
So
there's-
that was the chiropractic adjustment. Well, I think we can beat the Burger King adjustment.
Okay, good.
Just letting you know, Tom.
Okay, good,
Yeah,
good,
yeah,
good.
awesome, good. Okay, so the first thing we're going to do is we're going to go back to the X-rays. Okay,
Mhm.
we'll get X-rays of your spine because it's been a couple of years since Burger King adjusted you, right?
Sure, right,
Okay,
yeah.
So we'll get some X-rays there, and then we'll go from there. Sound
All
good?
right, cool.
All right.
Sounds good, buddy.
So Tom, we're going to put you in the computer here. What's your date of birth, Tom?
7/26.
Okay, sounds good.
Same years as yours, I think.
Yeah, perfect.
I'm excited about this.
Hey, we're excited.
I haven't had an adjustment in I remember it's been a long time.
Yeah.
Like a real one. It's been
Yeah.
years.
Yeah. We're excited. Yeah. Okay, now put your back against that board there, Tom. Okay, great. Hold very, very still.
I see my belt buckle. What's that little tiny bitty thing underneath my buckle?
Yeah. We're going to let your urologist discuss that with you. Yeah. You got some low back pain, huh, Tom?
Yeah.
I can tell. You have what's called come over. Yeah, I'll show you something here. These are called the disc spaces here.
Yeah.
Now you can see how thick they are up here,
Yeah.
here, and here. And do you see that?
The thin, right?
Yeah. So it's called a wedged and degenerative disc. So what happens is when you injure your disc, it's called desiccation. The disc loses its ability to heal itself and it starts to shrink. So instead of looking more like a sponge, it looks more like a flat pancake.
Wow. You know, I wake up in the morning feel like I've been hit by a truck right there.
Right. Exactly. Yeah. Yeah.
Wow.
So what happens is when the disc gets injured, it starts to move less and it starts to degenerate. Like I said, instead of a nice sponge, it goes down to like a pancake.
Wow.
So a healthy spine, your joints move properly, it's going to help rehydrate that disc. So it's going to keep it from flat and it'll get it more puffy. There's more space there.
Oh.
So that's the beauty of chiropractic care. By adjusting your spine, the joints are going to move better. Then you're going to have more inhibition, which is going to help rehydrate your discs.
Right.
And that's why chiropractic works so well.
Wow. Wow, that's awesome. I feel like I get and it's been years since I've been to a chiropractor.
Right.
But I recall feeling like I had like a lack of better word, a body buzz. I feel like I was like, wow.
Yeah.
And it was very euphoric.
Yeah, exactly.
Yeah.
That means all the joints are moving properly and there's a release of blood flow and the nerves are flowing properly.
Right.
So patients will leave here feeling, Doc, I feel euphoric, I feel more energy, I sleep better, etc. Because all those nerves are flowing better to all those body parts.
Nice.
Yeah.
Nice. All right, got it.
Let's take your neck X-ray, okay,
Sure.
Tom? What are you about? 5 foot?
I'm about 5'8".
Yeah, 5'8".
You know, with the right adjustment, I can hit 6'4.5".
Yes, you can. We're going to do that in about 3 minutes. So, Tom, this is your neck from the side.
Uh-huh.
Now, a normal cervical curve is 43 degrees, and you're much less than that. But when you're less than 43 degrees, that's what's called a structural problem. Okay? So, structurally, if you're not 100%, then you can't you're asking your body to be 100% functional without 100% structure. It's not going to work. Does that make sense?
Yeah.
Okay. Now when we zoom up here, this is the second disc. We have 2, 3, 4, 5, 6. You can see right here it's 6, right there. Does that look thinner than 2, 3, and 4?
Yeah.
Yes, it does.
Yeah.
Okay.
I'm more interested in these little screws in my jaw there.
Yeah, that's
You must have broke your jaw.
yes,
exactly.
Yeah. All right, Tom, you feel nice and relaxed?
I do.
Okay, so we got your x-rays all steadied up. I know exactly how to adjust your spine.
Okay.
This is where the magic starts to happen. This is where the rubber hits the road. Now, when I'm scanning your spine, right here, you're humped backwards.
Yeah.
So this is the apex of where you're bending forward to drive the car. You have 3 vertebrae out right here in the middle back. So I'm gonna go ahead and adjust that area first.
Okay.
All right, you're gonna hear clicks and pops. That's 100% normal.
Okay.
Ready for it?
Ready.
Here we go. Take a big breath in there, Tom. Let it all the way out. Good. Relax your shoulders. Relax. Beautiful. Relief. Amazing. How'd you like that, Tom?
Wow.
I think you like that.
I liked it a lot.
All right. Good. Now we're going to do a couple things here. We're going to check the length of your legs. All right. Now your right leg is literally a ½ inch shorter than your left.
Huh.
So what that tells me is your pelvis is torqued down like this.
Okay.
Okay, good. So when the pelvis rotates down, it causes what's called a functional short leg. And the reason we call it a functional short leg is because after the adjustment, it's going to be 100% back to its normal length.
Oh, wow.
Let's do your hip first. So let's face me right over here, Tom. Now take a big breath in there. Let it all the way out. Bring the knee down a little bit. Good. Relax. There we go. Awesome. Very
Wow, I
good.
feel taller.
Yes, that's awesome. Good. Now let's get you on the other side.
Oh,
Did that feel amazing?
That felt, yeah. Really.
That was it.
Wow.
Wasn't it? Yes. And then this hand on that elbow. Good. Bottom leg straight. Wonderful. Let's bring you right here. Bring your back right over here. Let's bring this back like this. There you go. Now relax your head up top there. There you go. Excellent. Good. Now we're going to adjust this 5th lumbar vertebrae.
Okay.
Okay. Big breath in there. Let it all the way out. Good. Relax. Nice and easy. There we go. Excellent.
Oh.
Nice.
Wow.
See?
I feel it more than I hear it, just so you know.
You feel it more than you
Yeah,
feel it.
yeah,
Okay.
but I get about it internally.
Come on up. Yep, come on up there. Good. Now you're going to have a seat in the chair. Let's get this neck corrected.
It's better than,
Yeah.
it's really nice.
Yeah.
It's like I've been so out of line for so long.
Yeah. And that's the thing about people's health is your health doesn't deteriorate overnight.
Yeah.
It's a very slow process. And then all of a sudden you think feeling bad is normal.
But yeah, and that's exactly.
Seriously. Yeah. And then you start to get adjusted, you start to exercise, you start to eat right, and your whole life changes. After this, we got a 3-hour workout together.
I did a push-up Thursday.
Bend your head to the left side, relax, lift the chin, sir. There we go.
Oh, God. They heard that outside.
Yeah, amazing.
Jeez Louise.
Good, now we're going to the other side. Relax your head.
Oh, wow.
Whoa.
Did you hear that? Oh,
Dude,
wow.
that's amazing.
Jeez, am I bleeding? Wow. Wow, I was talking, I didn't hear it in my back. I felt it more in my back. I heard it and felt it in my God, it's like we're a step, crackle, pop.
Yeah.
Like cereal right here. Oh, wow.
It's amazing, isn't it?
Yes.
So this machine starts to restore the curvature of the neck. Yeah. Tom's taking it all in.
Dude, this is...
We're done with the heavy lifting. Now you can fully relax there, Tom. There you go. Good. You could sit here all day, couldn't you? Tom?
Yes,
Yeah,
that's
isn't that amazing? So Tom traveled all the way up from Louisville to get a chiropractic adjustment.
It's so worth it.
It is worth it, isn't it?
It's an easy drive, a short price to pay.
Yes, it really
Wow.
is. I'm gonna do a little bit more work on your right shoulder, okay?
Okay.
Now the best news of the day, that's gonna be the best $700 you spent for
Yeah, see
for
there.
the-
And I got that on me. They got the guys at home. They got the 90-year same as cash program.
Yeah.
Gotta love it. Gotta love it.
Like
Gotta
I
love
said,
it.
there you go. Awesome. What do you think, Tom?
I love it. You kidding me? Oh, it's very euphoric.
It is euphoric.
I'm trying everything not to say orgasmic, but it's very true.
Yeah. Well, yes, exactly. Good way to put it.
Oh, wow.
Well, Tom, I'm sure glad you made that trip. Like I
Me
said,
too.
it's well worth it.
I'll see you tomorrow.
Absolutely,
Perfect.
yes. Your right leg's in short. Nothing we can't handle, right? Big breath in there, hun. Let it out. There you go. And let it all the way out. Let's lengthen this leg out. There you go. Left ear, left shoulder, hun. Lift up, huh? Oh my gosh. You had a stressful night.
I did, actually.
Not anymore. Not anymore. Put that under your chin there, boss. There you go. You never had the Y strap.
Never had the Y strap. Didn't know you did it until I saw the video.
Okay, well, the videos are a good thing then.
Yep.
So what I'm gonna do is you can hold on, but kind of relax your body, not kind of, just relax your body. I'm gonna do a couple tractions here. There you go. Do you feel that distracting your spine?
Yep.
Good, awesome, great. We're tractioning out the spine, all the way down. There you go. Where'd you feel it the most?
Like mid-back.
Mid-back.
Right below my shoulder blades.
So today we're gonna do the Y strap. So Brian, I'm gonna have you lift up your head. We're gonna go ahead and put the harness right here. I'm gonna give you a little tug. And that's, are you holding on there firmly, Brian?
Hold tight?
Yeah, hold tight,
Okay.
but relax your body. Let those big muscles relax, Brian. Okay, so you're gonna hold tight and relax, and we're gonna give you a nice little tug. Just a nice tug. There we go. Okay, Brian, I'm gonna relax that right shoulder to my hand. Perfect. That was good. Awesome. Well, thank you, Brian. And we're gonna bring the left side over here, a little bit more. Left side over here, Brian. Oh, that was perfect.
Real good.
How'd that feel, Brian?
Very good.
Tell everybody how you feel.
I feel better.
Great.
Definitely. Big difference.
Okay.
Nice little stiff tuck. There we go, awesome. We should have mic'd you up, huh?
I gotta hear that from here, man. How'd that feel?
Amazing.
And relax. There. Right. Ooh. How'd that feel?
It felt amazing.
This feels amazing and it's very effective. Just relax. There you go.
Wow, that really does pop.
Doesn't it? Yeah, awesome.
Good afternoon, everybody. It's Dr. Baker. I'm doing some dry needling on the bicipital tendon here. So watch the way we perform this procedure. Dry needle here. Tap. Advancing the needle. Any pain with this?
None.
Great. You see how that needle is tenting? That's really good. Now I'm going to twist it and lock it in. Third needle here. Tap. See how that needle's bending? So I'm going to take it out. Different angle. Continuing to advance the needle. Continue to advance the needle, and right there, turning it, locking it in. So this is dry needling for the bicipital tendon.
Brian has this kyphosis here too. See that hump there, guys? Yeah, so we're gonna reduce that hump with some adjustments. And then all the way out there, good, relax, nice and easy. There we go, that was awesome. Yes, perfect.
Yeah,
One more
Dr.
top.
Paul
I feel
has
nice.
taken such good care of him, and he has an excellent staff. I just recently threw out my back, and then I visited Dr. Paul the next day.
And then tell him how you couldn't walk last week.
I really had a hard time walking.
Big breath in, buddy.
I mean, I was
Let it
like
out
all
there, good, relax.
hunched over
There
and
we
stuff.
go. To the side. Keep on.
Oh, that was good. That was real good. Yeah, Don doesn't mess around.
No, I don't
He
mess
does-
around. This is amazing stuff. Come on, Hugh. Yeah, good job, Hugh. Good job, Hugh. Here, big breath. All the way out there.
Come on back with
Now
me,
let's work on your
okay?
side, okay? Now drop foot. Drop foot is the low back here. So there, you'll be like this one then. All right. Big breath in. Come on over here, Dennis. She might have the prettiest ears in the practice. As a matter of fact, I know you
I
have.
don't know.
Yes, you do. Yes, you do. There you go.
wow.
Amazing. Isn't that
Great.
cool?
Yes.
She's one of our biggest fans, Dennis.
They helped me 100% just
Yes.
in 2 weeks. Alright, you doing okay? Perfect. Stop doing good?
There.
So we're going to adjust your hip, okay? So I'm going to roll you way over like this. Then we're just going to totally relax. Take a deep breath in. All the way out. And then right there. How was that? Good?
Yeah.
Okay, great. Now lie on this side. Like this. Excellent. Okay, we're going to roll you way over here. Perfect. Take a deep breath in. All the way Oh, excellent. Good job. Come on up. I'll put you right here, okay? Relax. Feel some pressure right. Perfect. Awesome. Wow. Perfect. Check this out, Danielle.
Doc, what was that?
That's what you never do to your own neck.
You just did.
Yeah.
It's a smart
Never
man.
do that yourself.
You know what? I have come to the conclusion that men are just stupid.
What was that?
What?
Bubble wrap? Oh. What the heck?
Isn't that cool, Don?
Where'd you find out about this?
You don't mind feeling super wonderful, do you?
No. It's,
Okay, good. Okay, just check. Just check. Big breath in. Let it all the way out. Relax. There we go. Awesome. Take a big breath in. Let it all the way out. Relax your hip. There we go. Awesome. Good. Come on up. Let's get that neck adjusted. Now, I believe this is your favorite adjustment, isn't it? No more headaches, right? Perfect. Love it. Great. Relax your head. Ooh, amazing. Oh my gosh, that was awesome. Good stuff. Dry needling, and I'm going to tap it like that. It's in. I'm going to advance the needle.
does not hurt.
Good. Okay, so it's stopped right there. So we're actually going to turn it to get right through that tissue. Good. You doing okay, Carol? Great.
Perfect.
Good. We're going to turn it. A hit. See how it's stuck? Look at the needle bend there. So we're gonna take it out. We're gonna advance it. We're gonna take it out. And a little bit more. A little bit more. A little bit more. Advance it. Right there. We're gonna turn it to lock it in. Good. Okay. Now our second needle. Here we go. Relax your head in my hand. Just relax. Oh, amazing. Good. I'm gonna come down here to the third vertebrae on the right. Oh, excellent. Good.
It wasn't ready.
That's even better, Dad.
Oh my goodness.
Oh, there we go.
Oh.
There we go.
Oh.
You're welcome, Brad. Just relax your head in my hand. Relax.
Oh.
Beautiful.
Oh,
Awesome.
good.
Yes. Let's rotate to the side. There we go. There you go. Good. Let it all the way out there. Good. Relax. Oh. Relax your shoulders. Oh, amazing. Relax. There we go. Dad's the most vocal. Dad is by far the most vocal. Hey, good morning, everybody. This is Dr. Baker, and I'm here with Jeff. And Jeff has been a patient for a couple weeks now, and he came in with back pain.
Yep.
So, Jeff, tell me where your back pain was initially when we first met. And then
Probably a pain level about 8 to a 10, probably
Okay.
closer to a 10.
Okay.
Ever since my adjustments, I would have to say today I'm probably down to about a 1.
Great.
It's actually been quite remarkable.
Awesome. And it's been a couple weeks, right?
Yeah, it's been about 2 weeks. Yeah.
That's awesome. Now, a week ago, last Wednesday, we gave you an adjustment, Jeff. And then tell everybody what the result of that last adjustment was.
So last Wednesday at about, about 8 o'clock in the morning, I think I had an adjustment. I went to the golf course. On the third hole at about 9 o'clock in the morning, I had a hole in one. So it was the second one that I've had in my life. And 2 weeks ago, I couldn't even swing a golf club. So
Exactly.
after my adjustments and then the inflammation, everything went down. Then of course I ended up with a hole in one.
So a hole in one after last
tickled
Wednesday.
pink. Absolutely.
So
tickled
basically
pink.
what that means, everybody, is come in here, we'll give you some great adjustments, and everybody else can get a hole in one, right, Jeff?
We can't promise it,
Yeah.
but what the heck, at least it helped.
Exactly. Well, I appreciate you sharing your story,
Oh,
Jeff.
thank you very much.
You're
I appreciate
welcome.
you making me feel better.
You're
That's
welcome,
the
Jeff.
best part.
Thanks.
Thanks.
I'm so happy that tomorrow's your last brutal day.
I know, 4 months of my life.
I know, I've been with you every step of the
I
way,
know.
remember?
You've been a great help.
This is the top vertebrae of the middle back. Oh, that was so dang good. Senate, you're going to love me for those on your side. Big breath in there. Let it all the way out there. Senate, good. Oh, that was so good. And then all the way out the hip. There you go. So what I'm going to do is I'm going to go down to your lower neck vertebrae.
Okay.
The lower neck vertebrae control lateral flexion, moving left and right.
Okay.
I should say bending left and right, okay?
Okay.
So we're going to go down here to 6 and 7. We're a little bit lower in the neck. Oh, that was great.
Ooh.
That was it, buddy.
Oh.
That was the one.
Yes.
Okay. We'll get some extension in the neck here. Then I'll work on your traps, okay?
All right.
Good afternoon, everybody. It's Dr. Baker. We're going to perform an elbow adjustment on Paula this afternoon.
Not much.
What's up, Paula?
I don't know.
Let's try this
They're
one.
staying.
Perfect. That was good.
That one did it.
All right, all yours.
We're going to be performing a nerve scan with this instrument called the Titron 5000. So what we do here with the patient, we start the instrument right here in the lower back. We start the scan in the lumbar, moving up to the thoracic spine, and then the cervical spine, right like that. So this is actually taking a temperature reading of her nerves that exit outside the spine in this area, okay? This is the patient scan. So what this tells me is this patient has problems in the upper neck. It's C1, C2, C3, C4, C5, 6, 7, and T1. That's of a mild nature. And then a moderate nature down here in the lumbar spine, and then red would be severe. This is a really important tool that we use as chiropractors to determine where there's nerve pressure to a mild, moderate, and a severe degree. Now what we're going to do next is we're going to take x-rays of this patient. So stay tuned for that.
Open up those disc spaces too. Pressure off what are called the uncinate joints.
Oh! The beauty of chiropractic here, we have this pregnancy pillow that has a cutout here, two here. She'll put her face down there, and you can actually get adjusted all the way up to delivery time. So let's go ahead and have you lie face down on the table here, Puspa. And see how all the parts fit right in the cutouts? That's perfect. And how does that feel, Puspa?
So good.
It feels so good. Yeah, okay, so we're gonna perform some adjustments here. Take a deep breath. All the way out and right there. There we go. So you can get adjusted all the way from now until the delivery date.
I had migraines for 3 months daily.
What causes that migraine relief? Like, how do you get
Can I
that?
show you on the skeleton?
Yeah.
Okay, hold on. Good morning, everybody. It's Dr. Baker. Hey, we got a jam-packed day. I'm just reviewing my schedule before my patients this morning. We got tons of new patients, tons of regular patients. If you're suffering from neck pain, back pain, carpal tunnel, migraines, headaches, whatever, give us a call. We've been doing this for 29 years in the area. Baker Chiropractic and Wellness. I might not be able to adjust you today, but call 561-CARE and we'll make sure we get you in and get you guys taken care of. Have a wonderful day. Take a deep breath here. Perfect. Great. Just relax. All the way out. There, positive and fall. But you're doing great. That's awesome. Let's get you feeling so good you'll get back on that motorcycle.
I know, right?
So that's cool. So when patients come in from other clinics, we can just log in, abnormal curve there, pull up the schedule and pull up the x-rays. Relax. Nice.
Car accident about 7 years ago. Threw my back out to where I couldn't walk. Came to chiropractor twice, 2-3 times a week for a couple months, and I'm back to walking. I'm back to feeling better. It's helped a lot.
So I just saw a patient and his lower back was hurting right here. This is called the SI joint, the sacroiliac joint, okay? He's been having lower back pain in this right joint. He's done everything, the medical care. He comes in here to the chiropractor. We adjust his right SI joint and he's 100% better. We're gonna be taking a picture of Mr. Bones right here. He's actually 122 years old. I know he looks a little emaciated, but that's okay after 122, that's normal. So what we're gonna do here, we're gonna take a picture of the cervical spine, which is right here. There's 7 vertebrae in the neck. The x-ray beam is going through right here, so watch this, guys. So we're gonna come over here. Now what you see right here is actually a rod that goes up and down Mr. Bones' cervical spine here. And so that's just to keep the skeleton upright. But what we're actually looking at all these bones right here, so we look at the alignment of all these vertebrae. Isn't that cool?
So this is a picture of the first chiropractic adjustment that was done in 1895. So it actually helped to restore a deaf man's hearing. He was a janitor, got adjusted by D.D. Palmer, and was able to hear.
I had migraines for 3 months daily.
My cousin had migraines and she literally has to shut the whole house down, lights off, and she's like miserable.
Yeah, they had to send me home from work all the time.
So how did you get the migraine fixed? Did you take medicine?
No.
What'd you do?
Don't take medicine. The doctor told me to take medicine. He gave me medicine that actually had side effects that could probably kill you.
Oh my God.
And so I decided to come to the chiropractor. And it took 3 adjustments that they were gone.
And that was it. And you're like, why didn't I come sooner?
Yeah. And so coming in here, like I don't have hip pain anymore. I don't have knee pain anymore. And I'm like, woo, I can stand up all day.
I
Joyous.
know. And no migraines?
No migraine.
Isn't that crazy?
I haven't even had like headaches and nothing.
100% better after what, 3 adjustments, Jim?
What causes that migraine relief? Like, how do you get
Can
that?
I show you on the skeleton?
Yeah.
Okay, hold on. Okay, so Janet, who we just talked to, had a misalignment or a subluxation of this first cervical vertebrae right here. So what happens when that first vertebrae goes out of alignment, okay, the number one effect are headaches. So she goes to her doctors, takes medication, Advil, Aleve, whatever, but it doesn't do anything to realign your spine. So by realigning her spine, we took the pressure off C1, the first cervical vertebrae, and her headaches resolved. That's how chiropractic care works.
Instantly. That's pretty good.
Yeah, it's awesome.
And then what does medicine do? Does medicine just blocks the pain and then it comes back?
Yes, exactly.
Oh, and then this, when you make that adjustment, then you don't need the medicine because there's no pain there.
100%. Let me ask everybody, how many headaches do you think are normal? The answer is 0. There is no such thing as a normal headache. So I had a patient the other day say, Doc, I get normal headaches 5 days a week. I'm like, what's a normal headache? There is no such a thing as a normal headache. So if you're out there suffering from headaches, a lot of the times it can be this upper vertebrae that's misaligned. Let me ask you guys a question. How many out there actually suffer from headaches? I want to hear, comment, and let me hear how often you have headaches, because I'll tell you what, there's no such thing as a normal headache. What happens is over the course of time, your spine just doesn't get that way overnight, so you don't put your head on the pillow one night and all of a sudden wake up with all these problems. It's a slow, gradual change over the course of time, so slow, subtle changes. And then that becomes your new normal, and then you don't really feel like that's your normal, but you don't realize how bad you are until you start getting adjusted, and then you start to feel better, and it's like, aha, this makes sense.
Why didn't I come
Why didn't I do
3 years
this
ago?
before? And so I have patients, then probably one of the number one things they say is, why didn't I do this before? Why didn't my medical doctor tell me? And that's actually a good point. So my dad was a medical doctor. So they look at things differently. They don't evaluate x-rays, so every patient looks like a prescription. So the doctor will write a prescription for this and that, then you have side effects from that. So no offense to doctors. Doctors are amazing people, but they look at things differently, and that's the beauty of chiropractic care. We're turning over stones that have never been turned over by a medical provider. Hey, we love our medical doctor friends, but they definitely don't do what we do. What's up, Tony?
Not much, man.
Hey, this is my fishing buddy. We're going fishing. We call Tony, AKA the Bassmaster. How you liking all this chiropractic here, Tony?
I do.
What did you tell me when I first met you? You should have been doing this how many years ago?
I've been doing this about 5 years ago.
Absolutely. Absolutely. And how has it made you feel, Tony? How much better?
Oh, between night and day.
Night and day.
Yeah.
That's awesome. And what finally made you say, you know what? I'm gonna give this a shot.
Really, like I told you, I was scared.
Yeah.
You hear these things. You hear
and
that.
what do you hear? What type of things did you hear? I thought this interesting.
They'll hurt you. And I want to tell you something. That's not true.
It's not true.
The only hurt that I've got is that I didn't come to you before.
It's awesome, Tony.
Yeah. I never can get this right.
Yeah, that's okay. I'll get you. Awesome.
I was already in so much pain, I said, well, what the heck have I got to lose?
Exactly.
And he has taken all that away, really. I went to my family doctor.
Yep.
I slipped and stiffened up, didn't want to take the fall and tore the muscle. I went to him and he says, there's nothing I can do, it's just going to take a long time. And I said, what? He said, well, your spine, there's nothing I can do for it.
So when I first...
having a doctor say, there's nothing I can do. I come here and he says, it's going to take time, but we're going to get you back back to where you should be.
And that's actually a good
And
point.
it has been.
That's actually a good point, Tony. So the point is, there's nothing that a medical doctor could do. We just talked about that. But there's a lot
But
that a
we got-
chiropractor can
yes.
do. So there's a big difference.
And one thing that Dr. Baker has never said, I need surgery.
I know.
He's
Exactly.
never said that.
When I first met Tony, he was actually dragging his leg.
Yeah.
That nerve was so pinched he couldn't function. The left leg just wasn't working.
From here down to my knee would go numb.
Yes.
Totally numb. My leg has not been numb.
Great. And so what that means, we successfully took the pressure off of that pinch nerve that started in your lower back and then went all the way down your leg. And since he's been a patient, he hasn't had that. But the medical approach to this is drugs, epidurals, steroids, different medications with side effects. But if you have a physical problem where your vertebrae is pinching that nerve, which you did at L5, this nerve was compressing those nerves, you can take all the medication you want. It will not fix that problem. It needs to be manually adjusted. That's what we did with chiropractic care, and that's what we do every day here. And that's the beauty of chiropractic care, looking at things, unlike a medical doctor, we look at things through a different lens. So we're gonna do the Y strap, okay? So Sophia, lift up your head. Perfect. We're gonna put her in the harness here. How would you describe this to patients watching, Sophia? How does it feel?
It might seem scary, but it's really relieving,
Okay.
honestly.
Does it relieve all that neck pressure?
Yes, it does.
Wonderful.
It's just like a whole 10 pounds off your shoulder.
I love it. Let's demonstrate, shall we, Sophia? Great. Okay, so I'm going to take the slack out of her neck like this. I'm going to relax, taking the tension out of her neck. Warming up all the muscles, tendons, and ligaments. Then we're going to give her a little impulse. How was it?
Awesome.
Great. So that's it, guys. That's the Y-strap adjustment. Good afternoon, everybody. It's Dr. Baker, and we're going to do some adjustments on Puspa here. So we're going to make her first corrective adjustment right here. I'm going to place my hands here adjacent to the spine. Take a deep breath. All the way out and right. All the way out. Good job. Okay, get you on this right side. Look at the smile. Good, let's bring you over here. Deep breath. All the way out. And then deep breath. All the way out. Oh, great. This is everybody's favorite, I think. We'll bring this left side over here. Excellent. The right side, right. Perfect. How's that feel?
Good.
Great.
I needed that.
You did. Okay, guys, this is Bella, and this is her brother Caleb. So Bella is the youngest chiropractic doctor right now. She's going to adjust Caleb. Look at her technique. Wow, good job, Bella. How's she doing, Caleb? Is she doing good? Is she doing great? Give her a thumbs up. Great. Okay, now lie face down and do it again, Bella. Adjust him again. Good job.
Are you gonna search me?
Yeah, you want to. Okay, so we're gonna do, Randall. We're gonna take the slack out like this, okay? We're pumping the discs, letting them relax. And at the very end, we're gonna give Randall a little impulse. Great. How was that, Randall? Oh, look at the smile. Awesome, Randall. Today we're going to be performing the Y-strap, okay? We're going to put the Y-strap right here. We're going to tighten this up. So last time we did this on Randall, he loved it. He's asked for more, so we're going to do round number 2.
And lead a pain-free, healthy life. Oh, yeah.
What's up, YouTube family? Hey, I am so excited. This is a midweek. This is Wednesday. We've got 74 patients out there waiting for me, and I can't wait to adjust them and change their lives. Let's get it. Yep, I felt it. Nothing we can't handle, right? There you go. Workout's going well, like you said, sir. Leg all the way out. There. All right, guys. Hey, I just want to give you a little synopsis on what I did with the patient. He was here earlier. He had a condition called a retrolithsis. So retro means backwards. So what happened is you have 5 lumbar vertebrae. The 5th lumbar vertebrae slipped backwards. That's called a retrolithsis. And what happened is when that vertebrae slipped backwards, it pinched the nerves right here. So he was having severe pain down both the legs. That condition is called sciatica. So we put him under a care plan. We started correcting the L5 retrolithsis. And after the first 12 visits or 1 month of care, 100% pain-free. So this is the power of chiropractic and restoring the structure of the spine, because structure dictates function. Good to see you, Laura.
You too.
I'm going to ask you a very serious question, Laura.
Yes.
How many adjustments are you supposed to be getting a week?
2.
Yes. Now let me ask you another very serious question, Laura.
Yes.
How many adjustments did you get last week?
All right. Hot seats open.
How many this week?
1.
Okay, we got some work to do. Big breath in. Let it all the way. There. Whoa, she's making all types of noise on your side facing me. Now, how have your headaches been?
Great. No headaches.
No headaches. Good. Take a big breath in there for me. Let it all the way out there. Drop the head. Wow.
So much better.
Woo, buddy. Amazing. Let's keep you headache free.
Yes.
Relaxing. Lovely. As you prefer to be headache free, right?
So yes.
Nice.
Oh, yes.
Ooh, what's this one gonna be like?
You just wait.
You just wait.
You just wait. It gets
Good.
better.
And then drop the elbow on my knee. Go like this. You're fine. Good. Relax it. There. Beautiful.
Oh.
Yes. It's good. And then drop the elbow. Relax. There you go.
He has all sorts of tricks up his sleeve.
This is only adjustment 13 to 26. Right?
That's what it takes to get me subluxation.
That's whatever it takes, right?
Right. But that means I'm able to move and do everything that I need to do.
And lead a pain-free, healthy life.
And
That's a big deal.
Yes.
It's a huge deal.
And lead a pain-free, healthy life. Oh, yeah.
Awesome. Good. There. Beautiful.
He's going to do my wrist for me.
Okay, relax your finger. Relax. Ooh, great.
He's going to get my carpals done here.
Right.
See, I mean, it just shows how connected everything
Oh, yeah,
is.
everything's
and
connected. Yep, just relax it.
like that.
Good, wonderful.
Good.
Like I said, all sorts of tricks up his sleeve.
Right. Okay, relax it. There you go. Good. Relax. Good stuff.
Wow. To me, with getting adjustments, it makes me feel young, it makes me feel good. It makes my mobility skills a whole lot more better than what I was. I had degenerating disc probably like in the 3rd stage. I have an aunt that passed away from back injuries, and depending so much on pills. And she actually passed away from it. It damaged her organs, her liver and everything. So I knew that I didn't want that. I just tried all kind of therapy, acupunctures, everything, and nothing was working. I was just at my last, and I prayed on it and wound up seeing these guys on TV. I said, you know what? I'm on bending knee, God. What little is it gonna hurt to just try this one last time? Just try this one last time. I was at work and I was in so much pain, and I said, I'm going. And I cried to him, and he seen I was in pain, and I guess he got to be Moses, because I tell you what. He sure opened up the seas for me, you know. He sure opened up the sea.
Hey, YouTube family, we had an awesome day out there. We were able to help 75 patients. One of the most common things we see, guys, is almost everyone is humped over. That condition is called a kyphosis. Let's reduce this kyphosis. Now, why do you think everyone has a hump in their back? Well, you guys know why, right? Looking at the phone, playing on the computer, looking at the computer. All that causes this forward flexion of the middle back. One of the #1 things we see here is a bent over or humped up back. And chiropractic is so effective in taking the pressure off those nerves and restoring the function of not only the middle back, but the neck, the middle back, and the low back. Yes, it is getting better.
You are set.
That's the magic of chiropractic. So if you're out there, you're hunching over the phone, you probably are right now, right? Okay? Or at the computer, make sure you do something about it, because the sooner you do something about it, the better. You're on top of it, Hawk. You always have been, Hawk. Good. We really hope you enjoyed this week's episode of Accelerated Health. Make sure you do the 4 things now. Comment, like, subscribe, and hit the notifications button.
We'll see you next week.